The crux of the opioid and the fentanyl crisis, it's not just one area. It's multiple areas. It's the supply coming across the border. It's the cheapness of the drugs. It's the lack of penalty in the laws that we have to really go after these drug dealers. And then it's the new technology. It's the ease for people to obtain the drugs. And it's the lack of education. So there isn't really one thing. It's what you call the perfect storm when it comes to the opioid crisis and the fentanyl crisis. First, you have to attack this from multiple angles. You have to have the prevention, the intervention, the educational aspect of it, where you're getting to the public, whether it be kids, whether it be family, whether it be parents. And then what you have to have is really the prosecution and the interdiction side of it with law enforcement. So it's really all hands on deck to attack this problem. That's what we're doing.
I think fentanyl is the meanest drug we have ever seen. It's probably the most addictive and hardest thing I've ever seen anybody try to get free of. Suffering from addiction is just part of the human condition. And more people have these struggles than anyone would ever realize. It's in the neighbor's house, and it's the family down the street that hides it really well, and that these things touch all lives. And that we all hurt and we all need help sometimes.
You never think this will happen to you. You never think this will be your kid. You know that you're holding up a picture. That's all you got is your pictures and your memories. You don't have them physically here no more. And that's the worst pain ever.
It was the coroner that came, to get Zach that first mentioned that she suspected this could be a fentanyl death. And I was just dumbfounded. I didn't even know what she could be talking about, because we were like, he doesn't have a history with drugs or health problems or depression or any kind of red flags.
I believe addressing the drug crisis in Sacramento looks like partnerships between different entities such as the coroners, groups like Safer Sacramento, the district attorney's office, the DEA, public health. These are the entities that serve the community. In different aspects, we have different roles. But I believe that having partnerships with these different agencies can help us better grasp how do we help the individuals that need help? How do we recognize the signs of addiction? How do we prevent addiction? Getting the message out there to our community that fentanyl is around, it's going to be around for a long time, and that it's infecting our entire population.
I think the fentanyl issue in our county is profoundly complex, and that there will be an endless supply of fentanyl. That's not to say we don't do everything we can to go after traffickers and to do interdiction, but you have to do demand reduction. There has to be education about the risks of it. There has to be treatment for those who find themselves falling prey to the drug itself.
Approaching the opiate and the drug crisis that we're facing from a compassionate lens of we're trying to help our community and community members by providing them the medicine and the treatment that they need to help reduce their utilization of resources, but also to help them live a better, more fulfilling life is incredibly powerful arguments.
It's important to provide culturally competent care because there is no one-size-fits-all as it relates to health care. Everyone has their own individual needs, and it's important that we see everyone as an individual.
This fentanyl is in everything now. There's no such thing as recreational drugs. They're putting the fentanyl into everything. I think it's really important just to keep the news about fentanyl out there. Every death, every arrest, every drug bust, and the devastating effects that this has on families, and that there are 300 people a day in our country dying from drugs.
I think a way that we can help this is to bring awareness and to definitely let people know that having the mindset of not my child or you should have been there, and just having the mindset that fentanyl does not discriminate. It doesn't discriminate against age, race, social status, economic status. It doesn't discriminate.
It's very dangerous drugs out there, and people aren't informed on what they're taking, and it's deadly, honestly.
The current fentanyl crisis here in Sacramento, I know that it has been widely spread, especially across the young community. Like, they've been putting stuff in pills, in marijuana, or like just street drugs. It's really easy to get to.
The ripple effect of losing a child who was enormously successful in so many different groups is like a huge bomb exploding in our family and our community. It just caused an extreme, widespread trauma to everyone to think, how could this happen to a good person like this?
Don't ever think it can't happen to you. Don't ever say, not my child. I just feel like if we could educate it, get it out there, get it in the mainstream, decrease the stigma.
I had never heard of fentanyl until Spencer passed away. The pain. You get this aching feeling in your heart. And a false sense of hope that one day you're going to see them again.